Hello, everybody. My name is Harold Clarke-Lopez, and I will be your moderator for this panel discussion on reflections on the AIDS journey in West Michigan. At this time, I would like to introduce to you all the panelists for today's discussion. And if you can introduce yourself and tell us a little about your relationship with the HIV/AIDS struggle. And in addition to that, if you would be as kind as to tell us about your earliest memory of HIV/AIDS and what the memory is like for you. And going to my left.
All right. Well, welcome everybody for coming out today. I'm Tommy Allen. I'm a community member since 1981. I moved here from Flint. If you remember the 80s, it was not a great time to be in Flint. So as a young youth, it was time for me to move on. So I chose Grand Rapids as my destination. I would stay here and end up becoming a graduate of Calvin University, but not before a quick stop at the Cornerstone, which was then called Grand Rapids Baptist College, where they tried to kick me out for dancing to a pipe organ. So I decided it was time to transfer my credits and get out of there. So as an individual in this community, I was raised in a Baptist church. So being gay was something not welcome and definitely not encouraged. And if anything, it really led to a life of code switching right from the very start. The very people who were charged with my care were often the very people who would also, send me into internal damnation. So it was a very weird environment to grow up in Flint, in a fundamentalist home. Coming here, though, I thought I'd find my freedom and kind of staying on topic here and how, besides being an artist, but also being a communicator and a publisher now, one of the things that really stuck out to me was the silence of AIDS at the beginning. If you were in my position as a young gay male at that point, you were really just looking to start your life. And I really thought once college was behind me, I could start to be who I am here in Grand Rapids. Boy, did I learn a lot. So in that moment, my first exposure to AIDS as a topic was in 1983. And I was doing an internship down in the Cincinnati, Kentucky area for one of the old Carnegie buildings that was transformed into an art center. I thought I'd found my home, and then one day opening up the newspaper, in this case it was Newsweek magazine, read an article about, a silent killer, a gay cancer happening in the community. And as someone who was just coming out and beginning to enjoy being out, I found suddenly this feeling of, well, shit. Now this. I thought I had found my freedom, and felt like it was snatched away from me right at the start. So that really is my first foray into it. And I would have to say at that point, there was probably no going back at that point. But there was a lot of darkness, misinformation, but also a lack of support in Kent County for a very, very long time until things began to hit closer to home. And with that, I'm very grateful that the person to my left is here in this lifetime, because Jan Koopman is a big part of a lot of those changes that began to happen that made things better for a lot of the queer community of West Michigan.
Thank you, Tommy. Okay, I'm Jan Koopman. I was executive director of the Grand Rapids AIDS Resource Center from mid-1991 to I think actually 1996. Then had some time off from being employed in HIV, and then was the first employee of the HIV/AIDS Services, which is now Red Project. Purpose of that new agency was to get a needle exchange program going in Grand Rapids, which we did, and it has been very successful. So that was how I was employed for actual pay in the HIV/AIDS struggle, but it's become a major part of my life ever since then. My earliest memory of HIV/AIDS, before I was in Grand Rapids doing this work, I was a bureaucrat in Washington in the Commerce Department, and the windows of my boss's office overlooked the Ellipse, and there in about 1982 or 3 was the very first AIDS quilt display on the Ellipse, and it was just a few dozen panels. And I remember us looking out at the AIDS quilt and saying, I wonder what's going on, and will this become a big thing? That's what we were thinking up there. And then it became a major part of my life. And when I was at HIV/AIDS Services / Red Project, Michelle was on the board of directors.
Good afternoon. I'm Michelle Johnson, and I graduated from Grand Valley in the late 70s, back when there was something called a Thomas Jefferson College and College of Arts and Sciences and College 4 and William James College. But I was a CAS student. I got a degree in biomedical sciences. In fact, I think I had the very first immunology and virology classes that Grand Valley ever taught. And little did I know that just a few years later, all of that information pounded into my head would come in handy when I got hired at the health department as their HIV educator. I was in that position from 1988 until I retired in 2013. And I worked with lots of folks in the community like Jan and others. And my very first memory, though, of something new happening was at my first job. I was at Planned Parenthood as an educator for 7 years, which was a great background for working in HIV because I got kind of an expert training in human sexuality, especially adolescent sexuality, and some counseling skills. And I can see where I was sitting at my desk at the time when this article came out in 1981, talking about the strange cluster of illnesses among young, previously healthy gay men. And when I read that synopsis of that Morbidity and Mortality Weekly Review article from June 5th, 1981, if anyone ever read that, my thought was, this sounds like a new infection to me. You know, my biomedical sciences background kind of kicked in, and I remember thinking, I have to keep an eye out for this in the future. And then it kind of, left my consciousness for a while. And then when it was clear that something new was happening and that it was an infectious disease, then I thought about my friends who were most at risk. Because in the beginning, it wasn't called HIV. People labeled it GRID, gay-related immune deficiency. And that label gave kind of a banner of misinformation in a way, saying that only gay men had to be worried about this. So all my friends that were gay men and young at the time and starting out in their relationships, I really did fear for them. And I think some of that stigma has kind of filtered down to today. Many people thought, this doesn't impact me because I don't fit into this group. And one of my other early memories was finding out that a really close friend of mine from grade school had developed HIV and was actively dying. And so for some of us, this was a professional journey and at the same time very personal, as it may be for some of you in this room.
Hi, hi, I'm Gary Van Harn. I am very much a local product, born and raised around here. Like Tommy, I was raised in a very religious atmosphere, the Christian Reformed Church, very, very Dutch culture. And we didn't talk about our feelings. We certainly didn't talk about sex. So it was a very repressive environment. I kind of had an idea who I was from a fairly young age. But I was on a track to be the best person that I could be, as my culture and parents and family wanted me to be. I'm married. I was married. I'm the father of 3 children. And I was extremely aware of the news. I paid very close attention, read newspapers, magazines, watched TV. I knew what was going on, but I experienced initially the AIDS epidemic secondhand. And it was yet one more reason for me to be terrified of coming out of the closet, which I finally did in '89. And I kicked the doors down. I'd had enough. My first real exposure to AIDS was while I was still married. My neighbor and dear friend, Karen Henry, a local political activist, I believe it was her brother-in-law, Levi Camel, was dying of AIDS. And I got involved as a member of his care team. So, and the Grand Rapids Press, I believe, did a series of articles on Levi. They followed him for a year and a half, if I recall. Anyway, that was my first experience directly with AIDS. And what else can I tell you? I'm recently retired from Grand Valley. I worked here for 22 years. I was the evil textbook manager for the downtown campus for 8.5 years, and then proud and thrilled and happy to work at the Padnos International Center for another 13.5. Today, the 19th, marks the passing of my beloved partner, Milton Ford. He's been gone 11 years. Milton and I were the genesis of the LGBT Resource Center on Grand Valley. I also, with my dear friend Sarah Mahan, we started the Third Coast magazine back in 1995. It was sort of a broad general culture magazine for the gay community of West Michigan. And it took off. We ran it for about 3 years before we sold it. And, you know, I went from being a very private, timid person to a very public figure. So that magazine really brought me out, and I found my courage and my strength through that and this wonderful group of lesbians that I fell in with. So that's me in a nutshell.
Hi, I'm Aaminah Shakur. I use they, them pronouns. Okay, myself and my history, gosh. I was born in 74, so I was very young during the AIDS crisis in the 80s. I grew up in a very Christian environment, also here in Grand Rapids, where my mother did not talk to me about anything related to anything that could be conceived as sexual. My father gave me my sex education, which was really awkward. But I, in high school, became the person to get condoms from, and also hung out with lots of my gay male friends at a known hookup spot where I gave out condoms and also information on where to go for testing, where to go for care that would actually treat you well, which is very hard to find. I was a caregiver for several friends with active AIDS. I had a young man who I was friends with die in my arms when I was about 20. So I guess that's my relationship to it. My earliest memory actually was when I was in maybe the 5th or 6th grade, and the government had sent out like a pamphlet or something, and my father sat me down to have the conversation about what this disease is. And I was really lucky because he also said they're going to say that this is a gay disease and they're going to stigmatize the community. And that's not true because it's going to start hitting everyone. And I was also really lucky that I grew up in a family that recognized that I was bisexual really young, and also that I was not fitting into gender very well. And that just let me be who I was. I was really lucky in that regard. But my first memory would be when my dad talked to me about it and sat me down and said, this is a thing. And it's going to affect your community, but it's going to affect everybody. And don't let them stigmatize your friends, and just take care of people. And so that's what I did.
Thank you very much. Okay, so looking back, historically speaking, can you explain what it was like to be a part of the Two-Spirit LGBTQ community, or what it was like to be a Two-Spirit LGBTQ person during the years of the AIDS crisis? What barriers existed and what joys were still found? Anybody can take this.
I'm happy to start.
Okay, great, thank you.
So obviously I was very young when I came out, and I was in the bar on my 18th birthday. I was part of Windfire, a youth group at that time, that was actually started by a friend who I met later who did die from AIDS complications. I would say the biggest barrier that I was aware of was knowing that if you say that you're gay or bisexual, there were so many doctors who would not treat you, including in the ER. Family doctors of my friends were telling them, go to Macaulay to get tested. Don't ask me for a test, because then it's going to go on your record and on your insurance. And, but also then, like, if you go to the ER, they're going to be like, no, not treating you because you're a risk, just for being who you are. The joys really were community, though. Yeah, community. We had such a beautiful community. And I was young enough to properly enjoy it.
Go ahead if you want.
Okay. As I said, I came out in 1989, and by that time I was fully aware of how AIDS was contracted and how to take care of myself. And I had virtually no community. I had no in to the gay community at that time yet. I was mainly working 2 jobs and trying to raise 3 kids on my own or part-time. But I remember the general fear and hysteria that was sort of rampant everywhere, and the stigma that one had to bear with being gay, with being out. And that was something I'd already struggled with. I was done with that. So I was out, and I was going to take my knocks however they came. Things felt really grim to me. The government was generally indifferent and unresponsive. Organized religion was full on demonizing us. I remember being really angry, very resentful. I was cautious in my relationships with everybody. And at the same time, I was starting to feel really militant. That's kind of how it was for me back then. The barriers that existed were rejection by your family, by your church, by employers. You had to be really careful about what you said to whom, when, and where. God help you if you were a teacher, specifically. But at the same time, there were great joys. Community. I found community finally. I found my people. I fell in with a gang of chain-smoking lesbians, and they became my dearest, most wonderful friends ever. Warm, loving women. They threw the most awesome dinners and parties, and I met all my friends through them. The world just opened up for me, and many of those women are still my dearest friends. They took me under their wing and sort of raised me up. So, woohoo.
I love how you centered on lesbians in Grand Rapids, because I just finished an editorial where I talk about that I would not be the man I am today without hippie women and lesbians in West Michigan. But that comes later in the story. That comes in the 90s, really, when that begins to happen. But while we're still in the 80s, I think it's interesting you just mentioned the word militant, wanting to be militant. I think, coming from a family where my dad served in World War II and was very aware of the war, my dad was also not somebody who talked about the war until later in life. So, from a family perspective, we were, obviously very proud of my dad's service, and being the oldest child, there's a lot of expectations. But I did not choose to go into the military, much less want to go into the ministry, as they would call it, the church. That was part of my flight to get out of Flint and come to Grand Rapids. So, when we talk about militant, I as we reflect on this right now and think about what people would be shocked about if, looking back in the 80s and 90s, maybe it's just being so close to fundamentalism and now choosing, much like you have, as you did, to work in media, you find some strength in that space. You find community. You find the ability to flex a little bit of your voice that may not have been welcomed. And I think that's a big part of the 80s for gay people or anybody who was queer at that point, was you were just not welcome in any spaces. So finding your space or finding your people, as you say, is so very important. We can't have this conversation today without being in full recognition of what's happening in the government today. And it's not surprising to a lot of us because, being raised in a Baptist church, we sang hymns about going to war. It's not something I'm quite proud of, but I begin to understand quite clearly how we get to that militant mindset, why it might be easier for us to kind of switch into that, even when we're queer, into this idea that we must fight. And that's indeed what many of us did, especially when the government was completely silent and not giving us information. And, I think if you were to look back on that as a young person and actually be time traveled, you might marvel at, MTV and that it actually plays music videos all day long at that point, which were exciting to watch because they were often, media was often the place many of us found our identities, or we found people that looked or maybe expressed our viewpoints. So really, without a internet, I think the youth would be very shocked to know that you don't have immediate answers. And so as somebody who would become a caregiver for somebody, my partner, who had HIV, and cared for him for many, many years to the very end in our home, just finding information in the early days was really, really difficult. And I think people would really be shocked at how there was a lack of information even available to us in West Michigan. And we kind of expected it, to be honest. Up until that point, we always had the phrase, get thee to the coast, we'd hear. And what that meant in queer circles was, get the hell out of Grand Rapids, get to New York or San Francisco, you're gonna find community. And that's what a lot of people did. And I'll admit, I put a, want ad is what you do to meet somebody. It's like their version of Tinder or Grindr back then, paper. You'd put out an ad. And in the ad, I would place ads in other cities because that's what you did. There was no publication that was going to help you find somebody in Grand Rapids, for example. So you were really limited to these coastal cities. So choosing to fall in love here meant that I did not move away from here. And because of that, I found that I could build community here and I could build my chosen family here, as we often talk about. But I think what people would really be upset about if they were to go back is just some of the blatant policies that we had in place. Kent County, I know Jeff Smith has written about it decades ago now, maybe. Kent County had a program in the Sheriff's Department called Bag of Fag. Basically, it was entrapment. And they entrap gay men all the time in these spaces. Often, Aaminah has talked about these places you would go to hook up. And while some people get frustrated with the hookup culture, I think we have to remember, and again, what would shock youth today, I think, is that we didn't have an app. You didn't have spaces other than the bar to go to. It's not until 1990s we see a space called Sons and Daughters opens up. And that allows people to have a space outside of the bars where it's not about drinking. It's really about being around your culture. So it was a bookstore. It had videos for men if you wanted to buy one. It had magazines back in the day, so you didn't have to go, they didn't make it dirty to go get, in this case, pornographic magazines. But they also served amazing desserts, including, I would love to have another slice of that lemon cake, by the way, if anybody has a recipe. I know it's out there somewhere, and Jeff, who used to own it, has lived in another state for a long time, so anybody should just get him on the phone. But I think when we were talking about things that are shocking too, is when we look at HIV, how it was treated in the system, even when my partner in the 90s is going through it. And remember, we just went through a pandemic where after a year, everybody was getting angry and frustrated, and then you still get your vaccine at the end of it all. So I was kind of like, what are you complaining about? Because queer people, from the very beginning, were trying to have our voices heard, and society just was deaf. They did not listen. They did not care. And so it traveled into every aspect of the culture. We were not being spoken to directly. If you went through Macaulay Clinic, as I did with Frank, and then afterwards went through counseling to Macaulay Clinic was even, knocked at the knees by what they could do because of the Catholic Church, which meant that if you were in a support group, when they were going to go and remind you about safe sex, the people who worked for Macaulay Clinic, employed by the Catholic Church essentially, or the Catholic institution that represented them, could not show us how to put a condom on. So can you imagine this? They have to contract somebody to come out, and their sole job in this meeting was to put the banana out here and put the condom on. So again, it was very rudimentary in the things that, and the way people had to navigate just to get the people who needed the information what they needed. I will also say, when it got into the situation where Frank was ending up in the hospital, and what really sucked about that moment was Frank was trying to protect his family. Here's somebody who didn't go to college, who was working class, and just trying to make his family proud of who he is with everything he did. He was a popular DJ in our town. He DJ'd in Chicago. He had residencies up and down the coast. So I also learned I don't want to date a DJ ever again because they get in way too late. I'm in bed by then now. But when Frank was in Blodgett Hospital, which is part of Corewell today, for HIV patients, they would put a note, or they put your card outside your door, and you can only imagine what color it was. So if anybody was trying to be in the closet with or even have privacy, HIPAA, with what their diagnosis was, the hospital wasn't making it easy for any of us to protect people's privacy. You had a shocking pink card on your door that let everybody know who walked through it. Oh, pink. And again, remember the time frame we're dealing with. We're dealing with the time frame where everything is coded. We have our own coded language as queer people, how we talk with each other, how we maybe cruise with each other in that case. There's always these ways that we had to kind of operate just below the surface of the culture everybody else gets to navigate. So for a lot of queer people today, I think they'd really be shocked at how little life they would get to live out loud and proud in those moments, because there were direct consequences for it. And I can give you a long list of people who were very qualified, even myself in the early days, I would say, they would tell you, get that degree at Calvin College, you can go anywhere after that, unless you're gay. And that was what I always faced here. It was always a struggle to be even taken seriously as an individual, no matter what your background was, education, or what you had done for your community. So I would say that the community would really be shocked at how little power you really had at that point. And just swimming upstream, with everything else going on, was just exhausting in those times. But I don't want to lose sight of the fact is there still was joy that we found. And that I'll come back to at another point.
Okay. And I'd like to just briefly pick up on some of that. The LGBTQ community let me be part of the community as a straight, white, married woman with a couple of kids and who actually went to church. And I was so thankful that they let me in. And the assumption was made when I came in 1990, well, she must be a lesbian after all. Otherwise, who else would want to work with HIV? You must be a lesbian. I wasn't. But the stigma around being gay was profound and surprised me, having come from Washington, D.C., where things were a little bit more open. But over here, it was just so hard to be out about being gay. And you found community. The apartment lounge was the place where, after just one too many funerals one week, I remember a week of 5 AIDS funerals in Grand Rapids that I went to. And then I went to the apartment lounge and I just broke down in tears. And Milton and Ed sat there and they just patted my hand while I cried. after a hard week of losing people. The gay community let me in as an outsider, and I was always thankful for that. And maybe part of because I was this white woman who actually was Dutch and grew up Reformed, not Christian Reformed. And
The more liberal wing, by the way.
Yeah, the liberal wing.
The liberal wing,
So-
they had female ministers.
Yeah,
Well,
and,
they did
and we're open about LGBTQ now.
Yes, now you are.
And, but, I know I lost my train of thought.
Sorry,
What was
we're
I
of that
thinking?
age, of course.
Yeah, I don't know.
Oh, welcome to my world.
Yeah.
No, I think to play off that point though, and I don't mean to step on anybody here, but I was just going to share that, the foundation or the work that you're able to do though comes through our Grand Rapids Community Foundation. And it is not at that point, it is not the amazing foundation it is today and as big as it is today. It was 3 people. It was Diana Seeger and 2 other people. And she was relatively new in this role. And this is an era where women like Birgit Close arrives the same year who ran the Right Place. These 2 women who would become close to me in my life would share personal stories of those era that they grew up in or were ascending in their careers. But the Community Foundation at that moment, as they still do to this day, I think, with emerging topics that they are tackling within the foundation, it was a struggle back then. And I think you really hit on it, Jan, beautifully.
They supported the AIDS work, the Community Foundation. First money for needle exchange came from
Yes.
Diana Seeger and the Community Foundation. Amazing.
Did you want to share?
No,
anything?
no.
Oh.
Mine's the public health.
Public health one. Yeah.
Okay. Well, I think that kind of sums up a little bit about how we get to the moment where things start to become available. But again, if you are in the moment and you're a gay person in this town or anybody who's going to be impacted by HIV/AIDS, there's a long period of time of not knowing, of just waiting for something. We used to have at the Amway Grand Plaza, they used to have a magazine stand, and they had every magazine in the world. It was better than Schuler's, it was better than Elliott's. They had every magazine, and they had a whole section for queer people. And that's where a lot of us would go to get our information. There was a whole section out there of different magazines. So it may have been The Advocate, some other ones that have now folded, that were legacy papers that came out, again, coming out of the coast, were coming into our community. And these sometimes were the only places we could find information at that time. There was what year is it, 91?
91 when I came.
And even the Pride Center, which would be called the network, and very limiting, and even in its organizational articles. And again, we're dealing with time here, where language is always evolving. And the network arrives in 1989.
And I picked up my train of thought, and I'll be brief.
Good.
It was that I was this white woman who went to church, and so when that kid who escaped to the coast and got HIV finally came back home to die, these moms would come to me and say, I haven't spoken to him in 10 years or whatever, because they had kicked him out. And now he's back, and they had to figure out how to go, and it was so rewarding that most of the time they did get back together.
That's
Yeah.
beautiful.
Most of them.
I understand that there's somebody here on the panel that wanted to speak to the public health aspect.
Oh, me. Yes. Looking at it from the public health side about the early years, I came in March of 1988 to the health department, and I'll say it was an exciting time because we had a leader, Dr. Douglas Mack, who believed that our community had to do something about HIV. And he and others had this vision to pull together other leaders in the community. And our AIDS Council, our AIDS Service Provider Forum, and at the time we had an AIDS Foundation before the Community Foundation took that up. And so we looked at it as a 3-pronged approach, a stool with 3 legs to support each other. And the AIDS Council, which I was staff for, I was thinking about it last night, like who was part of that original group? And we had people from, we had the head of the Department of Social Services. We had somebody from the Medical Society. We had a judge. We had a county commissioner. We had people from, I think, the AIDS Task Force. We had social workers. We had the Director of Public Health. We had hospice. Can you think of who else? We had Planned Parenthood. We had so many leaders involved, because Dr. Mack's idea was that if you started with getting all of these leaders on board and getting their agencies to be involved, to work together and to reduce stigma, that we could have an impact. So that was part of it. And then the AIDS Service Provider Forum, were all of the groups that eventually evolved. Like we had the African American AIDS Task Force. We had Hispanics Against AIDS. We had the Grand Rapids AIDS Task Force. We had a variety of groups and medical people that were part of the AIDS Service Provider Forum. And then we had the foundation, which gave out grants. And then eventually that got folded into the community foundation. Because originally no foundation locally wanted to be the one to give out, AIDS money. So the AIDS Foundation did that. And then as some of the stigma went away, the community foundation took that over. And I remember that a few months after I was hired, I got to go to the 4th National HIV Conference in San Francisco. And I got there a day ahead of time, so I went to an organization called the Shanti Project, which was one of the first organizations to really try to offer all-encompassing services to people with HIV. And I went to tour their facility and hear about their services, and they asked those of us from around the country to give a little introduction about who we were, why we were there. And I told them about I figured Kent County has to be, way behind the curve compared to San Francisco. And when I told them about our 3-pronged approach and the various people that we had on our council and the leadership and trying to involve community members, their jaw dropped. They said, how did you get all those people to come together? Everybody's fighting. We can't necessarily get all the leadership to come together. So in some ways, our little corner of West Michigan was a leader. We were seen as a leader in the state as well. And eventually, when things became more statewide focused and there was a state council instead of the local council, I think there were some things
There's a regional council.
Yeah, regional council. I think some things were lost in that process a little bit. It was nicer when we had our own group to focus on our own community.
But also those councils had to have representation from people directly
Right.
impacted, from people who had HIV.
Right, exactly. And even I remember one of the county commissioner that was on the first council had lost a brother to HIV. And so some of the people in that group had personal connections, and others were just kind of being dragged along by Dr. Mack to open their eyes, open their minds, and think about a bigger picture for how can we educate our community. And that was my job, was education. And it was just amazing how in some groups, people were so open to information and education. And others, those early years were all conspiracy theories. This is God's plan to
Well, it's
get rid of
God's
gay people.
punishment.
Yeah, God's
Yeah.
punishment. So the old joke back then was, well, then lesbians must be God's favorite people because, not that many lesbians had HIV. That you can get it from just being next to somebody. It was a time when things happened nationally, like the Ray brothers, who were 3 brothers that were hemophiliacs, were banned from school in Florida, and a judge finally said, no, you have to let these kids go to school. And parents pulled their own kids out of school, and then somebody burned down their house because there was still so much stigma. Ryan White came along as a spokesperson. So there were things nationally that were also impacting us, I think, locally with awareness. But I think that our community, at that point, for me, it was exciting. There were people that were so determined to face this head on, and where everybody was learning and grappling in the process. And there were always going to be some holes where you didn't reach the right community, maybe didn't involve the right people, and it could have felt like a top-down type of thing. But I felt like we had the support. The year before I was hired, the assistant medical director kind of got pushed out because the year before that, he had talked about, the best thing we could do would be actually to distribute condoms and syringes. That could help lower the risk. And one of the county commissioners found that absolutely abhorrent and had a campaign for about a year to push him out. And so he was pushed out.
That's what we had to do.
Yeah, and I do recall that at the time, the head of our AIDS Council was a man called Jim Haveman, who went on to be the head of the State Health Department at some point. And I remember him asking me, "What do you think, Michelle? You went to that national conference. What do you think about condom distribution and syringe exchange?" And, I gave him my honest opinion. I said, you may be opposed to it now, but that's the future. That's where we have to be. And in about 1990, 91, something like that, I brought in some folks from the Detroit area to talk to our service providers, our substance abuse treatment counselors about harm reduction, and planted the seeds about syringe exchange. And I still remember that first workshop where this place, picture it filled, and all these counselors saying, "No, that will encourage drug abuse. How can you say that? That's just horrific." And I brought them back again, and by the next time, people were a little bit more on board, and within a couple of years, the syringe exchange
Yep.
happened.
Excellent. Is there anybody else that would like to add to this? Otherwise, we'll move along. And in the interest of full disclosure, because of the next question I'm about to ask, during this whole time when AIDS first started to make the headlines and everything, I was living in Miami, and I'd been living in Miami for 44 years. I got my bachelor's at the University of Miami. And so I joined ACT UP and a number of other organizations, but we can get into that a little later on. So the question I would like to ask is, were there any national historical events that impacted or reshaped how AIDS, HIV was experienced here in West Michigan?
I think television did that for us. I think the first big one really in the culture, if we're gonna look, I'm gonna look at it through the lens of my background in communication arts. So television, film, I think we're big leaders in that. And I think the access to cinema that was coming here at the time, which again, they used to protest back in the day. I mean, every time a film came to Grand Rapids that somebody didn't like, the whole church would show up and tell you not to watch this film, and that made you want to go even more. That's how I saw the film Mona Lisa, because Mona Lisa, and it's kind of about the Virgin Mary. No, we can't go see it, but we did. So I think culturally, I think the things that broke through for us were probably, I think maybe making an impact on the idea of awareness was, and it's because I think straight people in this case started to feel what we were feeling is, oh, anybody can get this. And so when Rock Hudson comes out as having HIV, it suddenly is being talked about. And shortly thereafter, we'll have Magic Johnson come out, another big one that begins to impact the culture and expand the conversation. So people who were engaging in activities suddenly were coming to their queer friends and saying like, hey, what do you know about this? Like, let me tell you, we got a decade of work ahead of you already. So I think pop culture did a lot of it. But I think the one that really, I think, broke through to a lot of us as, and I'll speak from the gay lens here, was The Real World, which was, I think, the very first reality show. And by the way, the only reality programming I've ever been able to really stomach was the first couple of years. After that, I go, it's a formula. I don't like it. And I'm even going to go on record. I've only seen one episode of RuPaul, so don't hate me. Don't take away my gay card. But I mean, I've been around drag queens my whole life. So it's like Friday night, I would rather be out than sitting in front of the television with Ru. So, but I do think it was The Real World. And when Pedro, which I think was Real World, was that New York or was that in San Francisco?
It was in San Francisco, but he was from Miami.
Pedro Zamora.
Zamora.
So Zamora that was Miami, yeah?
Yes.
Yeah.
Well,
From Miami, but
he was
in
from
San
Miami.
Francisco.
Okay.
So I think that one, I think made the most impact on all of us because he did what a lot of us wanted to do, and that was have a conversation. And he knew, I think he recognized he had this moment in time where this experimental thing called reality TV, which, really wasn't that experimental. We did it in the 70s, but that's another conversation. But what was really fascinating about this was he catapulted the topic and did it in a way much like Ryan White did, where suddenly there was an emotional attachment to the individual by people who never met this person, but was able to watch them on TV. And he almost became like a spokesman that gave everybody an opportunity to think about what it would be like to live that out loud and proud with your friends and chosen family. And could you expand it into the community as Pedro was doing?
Right, and he was a personal friend of mine. And we were both members of ACT UP together, among a few other things, but I can't get into that here.
And he was only
you can,
22
though.
when he died.
Yeah.
He was young.
Yeah.
He was
very
very
young.
young.
He was young, and I remember going to his memorial service on Miami Beach. And what's the name of that church?
Judson in New York?
No, it was the church that always never misses a gay event.
Westboro.
Yes, Westboro was out there protesting.
Yeah.
But anyway, does anybody have any other thing to add to any national historical event?
I found personally the Names Project quilt, that had an impact on educating people and, and also when AIDS started, people who were not part of the gay community could just think of gay people as just like one-dimensional. They're all about sex. But then you witness the partner who's changed sheets and given the ice chips and changed the diapers for months and months and months, faithful and lovingly. And then when the partner dies, they're not allowed in the hospital room because they're not related. They're not listed in the obituary because they're not family. And
Erased.
and when people saw the injustice of that, and then when someone dies, the therapy in working on a quilt panel and then going to a quilt display, it was very therapeutic for people and expanded people outside the community, expanded their understanding.
Does anyone here remember when Grand Rapids brought the AIDS quilt here twice?
Yep.
The last time was 2002. Yeah,
Down in
GRCC.
Allendale at
Yeah.
the,
Oh, Allendale, okay.
yeah.
and I agree that
CC did it before that.
that was such an emotional experience for people, whether they knew anybody with HIV or not. That was emotional, it was educational. At the same time, I remember a couple of friends of mine started the Stitches Dolls Project, and it's international now, and they gave women with HIV a doll about this big to decorate and to symbolize their own journey with HIV. And then they would take those displays of dolls places, just like the AIDS quilt. In fact, one time we had the quilt and the dolls project here. And that was another connection for people emotionally, because a lot of people didn't realize that there were a lot of women out there who had gotten HIV from their spouses who were hemophiliacs, who had gotten infected early before there was testing, before the blood supply was safe. And therefore, in the early days, there were children born with HIV. And I also remember do you remember the TV show Starsky and Hutch at all, if you're old enough to remember that? And I don't remember if it was Starsky or Hutch, but one of the actors, his wife Elizabeth Glazer, had gotten infected when she was given a blood transfusion after she gave birth and hemorrhaged. And she got HIV infected. It's before anybody knew this could happen. And her child that was just born then had gotten infected through then breastfeeding, and the second child was infected in utero, and their first child, Ariel, died of HIV. And I remember I showed the film about Ariel's life many, many times in our community, and everybody always cried. But she started the Pediatric AIDS Foundation, and that's another moment where people realized this isn't just gay men. This is people from all walks of life, including children.
We have a little more than 5 minutes left.
Really? Oh, wow.
And I do want to ask a a question in closing. Thinking back on when you first became aware of HIV/AIDS in the 1980s or the 1990s, what do you think would most surprise your past self about where we are today in preventing the spread or treating people with the disease? And
I will say two things. One, I never dreamed that there would be PrEP. You know, PrEP is drug treatment to reduce your chance of getting HIV. It's not a vaccine. Pre-exposure prophylaxis. So it's, with PrEP, it's much harder to get HIV, and if someone's viral load through medication is undetectable, it's practically impossible to transmit HIV. I never dreamed that would happen. And then I didn't dream that syringe exchange would be as successful as it is. I mean, we've cut HIV transmission rates due to sharing needles in Kent County by 2/3 since we started it. We have the lowest rate of new infections from injecting drug use as a risk factor of any city in the state.
you're absolutely correct. And another statement of full disclosure, up until April of last year, I was the manager of the HIV prevention program at the Grand Rapids Red Project, and I do know Jan. Anybody else?
It's amazing how well that's done.
So I currently work as the healthcare coordinator at Grand Rapids Pride Center. I think that my young self would be really shocked at how much stigma there still is and how difficult it is to find doctors that will care for you respectfully and manage, because I am constantly talking to doctors who say, yes, I do see HIV patients and can prescribe their meds, but if their case becomes complicated, I can't take care of them anymore. And I'm like, where are they supposed to go? They have HIV, of course it's complicated. It's gonna get complicated. Where am I supposed to send them then? I think my young self would be really, really shocked that, I was a bit of a hippie back then, so, I'm very big about we have to have imagination and dream about better things. And that's why we have syringe exchange programs now, right? Which Grand Rapids Pride Center also provides. But I think I would be very disappointed that we haven't done more and that it's still very hard.
Yes.
My younger self would have been very surprised that people could live a full life with HIV, that the medicines would be good enough for that to be possible if people get on the right treatment regimen, catch it early, adhere to their medications, because in the early days, 80% of people died within the first year, and only 10% were still alive 2 years after infection. So it was almost universally fatal. But I have a lot of friends that have lived with HIV now for decades and are living fairly good, healthy lives. What I would be most shocked about is that the news that I got yesterday, that our current administration is looking seriously at stopping all domestic HIV funding in the United States. And if that happens, we're not going to see people living decades with HIV. We're not going to be having programs like we've talked about that it took decades to build up and to fine tune. We're going to go back to the early days, and I hope that we go back to the early days of activism too, because that's what's going to be.
Because it'll hit people of color and other marginalized populations harder than anybody else.
Yep.
It's frightening.
I was just going to say, if I were to talk to my, look back, I think the thing it would be is, holding on to that bit of idealism in light of what you know. And I think what is most frightening about what we know about the fight to get the drugs, because Frank would die 6 months before the cocktail would become an option. Up until then, your drugs were just pretty much slowly poisoning you and keeping you alive, but you were not going to probably get better.
Especially when the only thing out was AZT.
ACT, and it was horrible. I mean, having to care for somebody on that junk was awful. And so I think there was always this idea that you were holding on. In fact, in preparation for this, I did the thing you shouldn't do, I think, and I went through and read a bunch of journals from that time, and I was like sobbing as I'm trying to work today because it just reminded me, that optimism that they'll figure something out. This can't go on forever. And I think what is most troubling for maybe somebody who's lived through it already and knowing how hard we fought to get the education, but to have the conversations in the community, to build the partnerships and allyships that we need in this world to do this work, because it is a public health issue. It's not a gay issue. I think what bothers me most is watching the slowly cutting off of aid to places like in Africa and around the world where we are actively making sure that medication is in the hands of people that will save their lives. And yet we know from people who take these medications, it's very important you stay on them, that you don't miss your dose, that you continue the routine that you have to go through, because what comes after is mutation. And I think that's what a lot of us are afraid of, is just, I think that optimism or idealism I had as a youth, I would want to say guard it, but stay active, stay angry when you need to be. And I agree. I wish we had an ACT UP here at the time, because I loved everything they do. There's a great film, by the way, called BPM, which is about ACT UP Paris. It was probably the only film I think really spoke to me the most about what we were going through, and it was done in such a beautiful way. So I encourage you to look it up. Beats per minute is what it stands for, but BPM, and it's hard to watch, but it's really worth the view.
At this time, I would like to open up to questions from members of the audience. Please feel free, ask us anything, and we'll try our best in order to answer any questions or concerns that you have.
Thank you so much, Harold. And let's have a round of applause, too, for sure. Thank you. What a great and informative panel on so many levels. I would also like to ask that if you would like to ask a question or make a comment, if you would let me know so I can come around with a mic, because this ensures the most accessibility for people of different hearing abilities. And also, if the question's not on the mic, then it will not be on the recording of this panel, most likely. I know a lot of people, sometimes people resist this because they want to holler. And I understand maybe if things make you want to holler. If I could go back maybe a little bit, I think it's Marvin Gaye. But it'd be great if you would raise your hand and use the mic. Does anyone have a question now? And I will run up to you with the quickness that I can muster here. And it's okay, I think, if we go a little bit into the break with the questions, because we did get a late start.
Thank you, panelists. What about local politicians? So during this time, I was living in Wisconsin. I wasn't around here, and the mayors. I think someone referenced a county commissioner. But what about the governors, the leadership of the state of Michigan, West Michigan political leaders, whether there were city commissioners, mayors? Like, what was the story happening with those prominent people?
Mayor Logie really is the kind of starting point, I would say.
Yeah, and that was really, trying to briefly tell the story, needle exchange. We had a client at the Resource Center who was a gay man who was HIV positive, and Dan decided that it was really wrong that we didn't have good options could do for people who injected drugs. We could do safe sex for gay men, and tell everybody about safe sex and all that stuff, but drug users were just told to quit. He went to Fountain Street Church, and every coffee hour he could get, he leaned on John Logie about the needle exchange and how it didn't increase drug use and it saved lives, blah, blah, blah. He leaned on John Logie every time he could, who was the mayor of Grand Rapids at that time. And then one day, Dan called me up the day before the State of the City address in 1997, I think. And he said, John's going to talk about syringe exchange tomorrow. And oh my God. And he did, and he asked for an AIDS policy task force to look at drug court syringe exchange and medication-assisted treatment, right? Or something.
I think so, yeah.
And 100 people volunteered. And he said, I'm not sending any of you home, and we all worked for a year. And at the end, they recommended that there be a syringe exchange program in Grand Rapids, and there was.
And he got the police chief at the time on board. He was the one that was sort of against it, but he got him on board to not bother the people getting the clean syringes on the days of the syringe exchange, not to arrest them, not to harass them.
It was on South Division.
And literally, what is it, 1.5 million syringes have been exchanged at least, something like
At
that
least.
since the beginning?
But the
It's
first
been a
weeks of
larger number than that.
Larger number than that, yeah.
The first weeks of syringe exchange, all of us on South Division at Heartside Ministry, all of a sudden the cops started hanging out in the parking lot, by the club over there, looking for people with warrants out for them. And so I called the mayor and I said, this is happening. And that really is a deterrent for people to come get syringe exchange. He said, and John Logie just said, I'll talk to the police chief, and it stopped.
Yeah.
I think even before we get to that moment, we still, I think to answer your question about politically, I think it's always about counting the votes at the end of the day. There's an old saying in Grand Rapids, it's like it only takes 4 bad votes to change the course of your city, because we have a 7 council. So with that in mind, we knew that everything's going to be a numbers game. And so in 93, I believe it was, when we made our first attempt at trying to do some sort of like civil rights protection, it failed horribly in the sense we didn't have the votes. And so what would happen under John, which I love, I also love that when John was running, I was a young intern at a radio station, and he was running against the traditional West Michigan candidate, and then there's John the lawyer. And everybody really felt the Vander something was going to win. And because, Logie versus Vander something, I mean, name recognition means a lot in this town, and we're very Dutch, I know. And it's the 80s, or late 80s, 90s. So when John gets elected, John begins to take steps to really begin to innovate City Hall. And one of the areas was making sure people feel welcome. But unfortunately, it took until 94, and then running candidates who could then have a chance to sit down and have that vote. We replaced the people that were the no votes. And we started to build a commission that was going to be sympathetic to the needs of a growing city. And John understood that. He understood where he was. And I think we needed a lawyer at that point. It's interesting, we've had a lawyer, a minister, and a social worker since I've been politically active in this town. And boy, does it show. And now we have David LeGrand. So a businessman, but many other things as well. But I do think when it comes to John Logie, it's really important, to your point, is that Logie, with people like Hartwell at the time, who was a commissioner, they were the ones who were often recognizing we needed candidates who were sympathetic. They were not going to run a gay candidate at that point. And in fact, very few have actually ever run as a result, even out. It's, again, you could not be out back in those days.
Thank you very much. Do we have any other questions?
Just a moment.
I'll just sneak in real quickly that it took 6 years for President Reagan to
You can say the
mention
word.
HIV,
Yeah.
6 years into the epidemic. So from national on down, it was a mixed response.
And he was aware on day one.
Yeah.
Bill and Hillary Clinton were the first. Bill Clinton was the first presidential candidate to visit the quilt on Cleve's birthday.
And thank God for Luke Sissifag, who showed up at a press conference with Bill Clinton and put him on the spot. And that's why I love artists who are not afraid to be active.
Okay, we have another question back here.
So Michelle had mentioned about the efforts of the current administration and trying to, I think you said that they're going to be cutting funding for a lot of the local communities.
Well, we don't know yet. They're
Yeah.
considering cutting all domestic HIV funding.
And this panel's done a great job so far talking about the impacts that the older generation of the gay community has gone through, their struggles and the oppressive nature that society has put on it. But I wanted to see, does the panel, what are your guys' opinions on struggles that the younger generation could potentially face or are currently facing things that we could see, 10, 20 years from now as things progress.
Thank you.
Okay, so I talk to lots of young people and also lots of elders, people older than me. To be honest, young people are facing a crisis in part around education that does not reach them and that doesn't feel relevant to them. And also not feeling cared for. All of our young people ask for, where can I go to a doctor that's actually going to treat me with respect? Where can I actually get hormones? I think that when it comes to care for HIV, our community doesn't listen to young people very well and sort of assumes that they should know better. But young people are, young and trying to enjoy life. And I'm meeting a lot of young people that are newly acquainted too personally with HIV. We like to talk about how our numbers are great compared to other places, but, we really need to have folks who young people feel safe with and can connect with. And we need to be more innovative with how they can access information. And yeah, it's a little rough for the young folks right now, honestly, because they feel lectured at rather than actually cared for. And I think that all of us can relate to that because that's how we felt too.
I'll just say that's a little bit of a hard question to answer. It depends on what's going to happen, in the coming months with funding, because things take money. Coordination takes money. Educational materials take money. And if the philosophy has become none of this matters, you're on your own, then in 10 to 20 years, I think it'll be a very sad state of affairs. I think a lot of what we'll have done over the last 40 years will be wiped out. Unless enough people are pissed off enough to say enough is enough and we have to stop this. We can't tear everything down because it takes way too long to start over. And I remember in the early days saying, HIV is not the first germ to come along, new germ to come along. It's not going to be the last. We certainly saw that when COVID happened. Who knows what the future could bring with other pandemics, especially if we stop putting time, effort, and money into keeping people as healthy as possible and giving them the tools for that. Other things are going to arise.
Thank you. And do we have any other questions to ask of the panel? Anybody?
I have a question, actually, if nobody else has a question. I think that this is such an important history, but like a lot of really important historical topics, it's also a traumatic topic, and we have in the room with us some people who work at libraries and at local museums and things. And I wonder if you all might like to share, how do you think those institutions and historians like myself should approach telling this topic? In a sense, I think, we've asked you here to share some things that are deeply disturbing and rightfully so, and as people who want to tell this history, we have volunteers who work for local history organizations. How do you think they should approach something like this?
If you don't study history, you're bound to repeat it, right? So learn from that history that if you allow stigma and bias to get in the way of protecting people and helping people be healthy, if we lose those parts of us that care about marginalized people. We're going to do it all over again. There was no federal money for HIV care after tens of thousands of gay men and drug users had died. But the Ryan White CARE Act was named after a nice little white hemophiliac kid. That's when there could be federal money.
Yeah.
Not for gay people or people who injected drugs.
And I would just say to remember that a lot of the best action came from grassroots efforts. And it wasn't all fancy organizations, that the momentum started with ordinary people deciding to get together and fight.
Right, and in the early days, I was in Miami, as I said. I was talking to a friend, and I said, nobody is going to do anything until someone who's prominent gets sick and die, and then Rock Hudson.
Hudson. Everybody's favorite closeted actor.
And Mary
Well,
Fisher
to a
spoke
point.
at the Republican convention,
Yeah.
a white woman whose ex-husband had injected drugs and she became infected. And she was friends with Gerald and Betty Ford and was from Michigan. And she spoke, and that had an impact on people too.
I think just the stigma about even talking about it at those times was the risk one had to take, to be your ally even in that moment. I think the hope that came out of it for me, though, if I can put a positive spin on this, was my college roommate who I came out to. And, the first thing after you come out to somebody is like, well, does Karen know? I go, who's Karen? It's like, well, Karen's in love with you. Don't you know that? It's like, oh, my God, I got more to deal with than just coming out here. Now I got to go talk to Karen and let her down easy. But I think the positive stuff is my roommate Randy later on in life would keep me close to his family, and I always liked that because, again, going back to the misinformation years, which again, that's, I think we're all worried about what comes next in the Trump administration is a lack of information, so misinformation will grow. But in the misinformation years, we weren't allowed to hold children, we weren't allowed to do certain things. People would often question, should someone have AIDS even hug you? And it just seemed weird. I mean, I know Diana Seeger had shared that story about Wood TV8. There was somebody who came back who had a relative who was dying, and she hugged them, and she got so much flack for hugging someone with AIDS. Like, how could you do that? You're putting yourself at risk as a woman. You're single, And so I think the hope here is that people like Randy, lived an open life as a straight man with his family. And so one day when we were waiting for my partner, Frank, to come downstairs for dinner, Zach looks at me and goes, how is Frank's AIDS doing? How's he doing? And I'd never heard a child ever say those words, and he was probably like 4 or 5 years old. And I looked at Randy like, whoa, like what's going on here? I was more scared and afraid. But he says, we believe in being open with our child when they have questions and not giving them, half-truths or things. He goes, if they're asking questions and the moment is right, we're going to tell them the truth. And so I found hope that people were out there in that moment already doing the work that I couldn't do maybe, but they could do it in the spaces that they were in. And so I think that's what gives me hope is that this conversation today, but also the conversations we're going to be having in the future about healthcare will continue on, and not just in our circles, but in other circles as well.
I think we have one more question from the audience.
Thank you so much. And I've been very moved by the presentation, informed, moved, excited about learning more. But I'm going to piggyback on Nora's question. Nora works with many of us who are involved in doing historical research and use libraries a lot, records. So some of our minds are going towards, in 50 years from now, someone wants to know about the AIDS crisis, and where are they going to be able to find out about it? And I kept, every time you were mentioning something like the Third Coast magazine, I'm thinking, I hope a library has a copy of that, and the other things. And I just wondered if anyone has emerged who was directly involved in the movement, who is really interested in this historical side. And I realize that's difficult when it is a painful topic. But, are you...
I almost brought the book with me. It's very old by now, but and the band played on by Randy Schultz. All libraries should have a copy of that because he chronicled their early years and all the players, the politics, everything behind the early years of the HIV epidemic. I think that's a pretty important book. Cleve Jones,
Still alive?
yeah, still
Oh, yeah.
alive.
Still with
And
us?
Healthy.
And just
Yeah.
turned what, 70?
He's 70, yeah.
Who started the AIDS quilt and worked with Harvey Milk. I mean, anything written by him, Stitching a Revolution, things like that. Mary Fisher's written several books too. There are a lot of folks like that at least in book form. But I think that some of our local history is a bit lost. When I left the health department, I didn't take most of my stuff with me. I'm not sure they kept great records of what did we do in the early days.
Yeah, I know that when I read those titles that were just mentioned, and it helped on my journey to becoming a VEQ. You remember that? For those of you who don't know, VEQ means very efficient queen.
True. Which is not my strong suit.
Well, anyway,
ADHD, come on, you know what you get with me.
at this time, I would like to reintroduce our panelists, and please feel free to give them a round of applause as I mention them individually. Our first person is Tommy Allen.
Thank you.
Michelle Johnson-Houghton. Jan Koopman. Aaminah Shakur. And Gary Van Harn. My name is Harold Clarke, and I would like to thank you all for coming and joining us here today for this very enlightening discussion. Thank you very much.